Hey, Dane Matta here, founder of Physical Therapy Biz, and today we're going to get kind of tactical. I know we get this a lot. A lot of people listen to the podcast, watch the YouTube channel. They want to know, hey, let's get into the weeds. Let's get tactical. Let's talk about the things that are actually working in the clinic. They're going to help you really succeed. And this is something I want to do today, where I want to talk about 3 drop-off points that we see in clinics that you can start focusing on right now that are going to help with throughput through the entire sort of business system that you have to help you improve both referrals as well as recurring revenue. Okay, so just these 3 areas, if you just focus on these alone, should dramatically improve your practice if you're not tracking these already. Okay, so let's talk about, kind of where we see these drop-off points and what you can do about it. So number 1, let's talk about these 3 areas. So the first one is in your conversion to a plan of care. Okay, so this is when somebody comes in your office and they have an initial evaluation with you and they decide whether they want to solve a problem for the long term, or if they want to, or they don't want to do that, right? Or if they decide that it's not the right fit for them, or they don't see enough value in it, whatever it might be. This is your, in some cases, considered package conversion rate, right? So a package of visits is what many people are using as far as setting up a plan of care. There's multiple ways to do this, but this is just a variation that's very common. So you might say, all right, cool. You are a 40-year-old man who has knee pain and back pain. I would fall into this category. You got some work to do. This isn't going to happen overnight. My recommendation is a 10-visit package that we can spread out over about the next 3 months. Here's what that looks like. And, then we can get to the point where we resolve symptoms. We really start to make progress in terms of you being able to resolve this long term, and we teach you how to keep it that way. So I say, okay, cool. I'm either in or I'm out. And this is something that, we'll see people convert anywhere between 50 and at the high end, maybe even 90% based on the population they have come in and their staff. Now you're going to have people that have acute injuries and things. It's a youth soccer player that's spraining their ankle, something like that. They may see a couple times. There's no reason for them to commit to a big plan of care if they have something really simple. This is a portion of what we see that comes in the clinic, but more often than not, a lot of the people that we work with, they are dealing with either chronic or, acute issues that are typically chronic in nature as well. They've just been exacerbated with something that they've done recently. So these are usually going to be longer periods of time that we need to work with somebody to make these habitual lifestyle changes, to improve mechanics, to build strength, to improve mobility, control, all the things that we help people with outside of just symptomatic change, which typically happens pretty fast. So getting somebody to commit to a plan of care is a big deal in these clinics because it eliminates drop-off. It helps hold them accountable to the changes that they need to make, because most people are going to drop off around visit kind of 2 to 3. If they don't do this, this is where they see symptomatic change. They don't realize that the job isn't done yet. They still have work to do. There's not a long-term change in place. And so they're like, cool, I'm good to go. But then their symptoms come back and they think you're not very good at your job. When in actuality, we know we have a lot of additional work we need to do in order to save that change, if you were to think about it that way, really to create a long-term change. So this is the very first part. So this is conversion. Okay, so conversion to a plan of care where they decide to do that or not. The second portion of this is actually just as important, and it's completion, right? So it's actually the plan of care you set out. Let's say, in this example, 40-year-old male, knee and back pain, 3 months, 10 visits is what I tell them. It's basically going to be this. We'll probably see you once a week for the first, 4 weeks, and then we'll start to spread it out every other week for the next, 2 months as we really start to build strength and build a program out for you that's going to require you doing a lot of, exercises and mobility work that's specific to the problem that you have. But I can't do your squats for you, right? I can't do those reps for you. You have to do them. We have to build that and progress that for you specific to the problems that we find, right? So we may see you, let's call it, 10 times over that's 3 months, right? So 4 the first month, and then let's just say 3 and 3, because my math was off. So 4 month 1, and then 3 month 2, 3 month 3, right? So we start to spread it out a little bit more. Well, we want them to use their visits. This is really important. So one of the big mistakes that people make is they are great at selling a plan of care, and then they're really bad at getting people to complete the work. And this usually happens when somebody gets about halfway through a plan of care. They're 5 or 6 visits into a 10-visit program, and they're like, I'm good. I don't need to come back in. And what has typically happened is the clinician has done a bad job of educating them on why they need to finish this plan of care. So we know symptoms will resolve, especially for a clinician that is a pretty good manual therapist. Like if you're doing dry needling, you're doing some hands-on work, you're a good manual therapist, you can create a symptom change relatively fast. The structural changes that need to happen take time and they take effort, and it takes the right exercises, the right amount of dosage, all the things that we have to be able to help people with, and compliance and accountability. So when someone drops off halfway through, what happens is those visits just sit there. And they sit on your books as what would be considered, visits that you haven't earned yet. So that's revenue that you haven't actually earned. And that is not something that you want, as well as you don't want that for the outcome for the patient. So we want to get them to finish their plan of care. Come to your visits, finish your plan of care. This is what you need. This is what we have to get you to do in order to get the outcome that we want, because that's essentially the biggest part of this is getting them that big outcome, that long-term outcome where they can get back to things that they like doing with the people that they like doing them with, right? And if they only do half of it, they're not going to get the full benefit from the actual program. But the other big thing is you have these that just sit there, and then eventually maybe they come back in for other things or whatever it might be, but you just didn't do as good of a job as we would like to see of you actually implementing the plan you're telling them they need to do from day one when they commit to it, right? So this is actually completion of the plan. And then the third big drop-off point is from completion of plan to some variation of a continuity offer that you may have, to offer them. And there's a lot of different variations that people have with this. I'll say the sort of most common ones that we see are, it might just be an ongoing visit or two a month. Maybe they really enjoy manual therapy, right? Maybe they really like to get hands-on work done by you. You're really good at it, makes them feel better. They can train harder, they can be more active, and this helps them stay that way, right? There's definitely a place for what's considered like maintenance, which I think is historically a terrible word in the physical therapy world, but people like it. People go to chiropractors, massage therapists, acupuncturists, they go and see people, stretch labs for things like this on a weekly, monthly basis, and they see a lot of value in it. And if you don't think that people see value in it, then you're just wrong, and you're really losing a lot of money and leaving a lot of money on the table that you could be making in your business for something that they see a lot of value in anyway. So there's going to be a percentage of people that want to do hands-on work with you if that's your skill set, right? Some people might want to do remote coaching with you. Maybe they like the way that you build their programs out, especially as you build them back up towards the tail end of their plan of care, because it starts to look more like training. And they say, man, my body feels really good whenever I train this way. I don't feel as beat up. I feel like I'm making really good progress. My joints feel better. I feel like I'm getting stronger without having these setbacks that I was having when I was training a different way. That's awesome. Cool. We can definitely keep doing that. And maybe it's a variation of just a program. It could be just straight that, right? It could be that with communication. It could be that plus an in-office visit. So you could set that up to where it's a combination of an in-office visit and programming. It could be any variation of this, but a lot of people do really well with the style of actual programming that we do as clinicians that understand strength and conditioning variables, and we can build that for them, right? So that is a very, very successful continuity option for a lot of people. The third thing would be some variation of in-person strength and conditioning, right? So maybe you have in-person small group work. Maybe you have personal training that you offer, something in-house that's going to be in person that's not necessarily digital or just solely focused on, manual therapy or getting somebody to feel better symptomatically. And for a lot of people, moving them over to something like a small group training, group is a great continuity offer and something that they really like. I mean, imagine if you keep getting hurt at a gym and you don't know what to do for training, but you don't want to do it on your own with a program. What a great way to continue to get healthy and stronger and bridge, from going from physical therapy back to activities that you want to do with a small group led by a physical therapist. Like, what a great place to do that. Misery Loves Company is a great way to train. You can have it programmed by somebody that understands the injuries that you've gone through. Great continuity offer, right? But having something in place for people to then ascend to is really important, right? And if we look at the numbers on this, like this is where it makes a meaningful difference in your business over the course of 12 months. So let's say you have 10 people that come into your office, and let's say there's two different clinics, right? Clinic 1, they have 10 people that come in, 10 new patients that come in, and they convert to a plan of care at 50%. Okay, so their first drop-off point, they go from 10 people, 5 decide that they want to solve a long-term problem, commit to a plan of care. Okay, so 5 out of 10. Now, let's say that they have a 50% drop off in people that actually commit, the people that finish a plan of care. So now they went from 5 people that committed to now 2.5 people that have actually finished the plan of care. That means 2.5 other people have dropped off and they haven't actually finished their plan of care. Now let's say you have 50% of those people that move to a continuity offer. Now you have 1.25 people that have moved to something ongoing from what you've offered them that have finished a plan of care. That which is, by the way, the highest group of people that's going to move over to continuity is people that have actually finished their plan of care, because they put the work in, they like what you're doing, they have got the outcome that they're looking for. That's the most important thing. And they're ready to see what else you can help them with, because you're obviously awesome. So this is Clinic 1. So Clinic 1 starts with 10, and at the end, they end with one person doing continuity work on a monthly basis, some sort of offer for them, right? Clinic 2, let's say they get the same people, same 10 people, but they're better at converting on the front end. They understand how to have conversations better. They understand how to actually help people achieve long-term goals and have conversations with them about why they're actually there when it's not just their knee pain. So they convert 80%. So 8 out of 10 people move over to a plan of care with them. Now let's say of those 8 out of 10 people, 80% of those people finish their plan of care, which this should be really high. They've already committed to it. You just got to get them to come in. This should actually be the easiest thing for you to continue to do. Getting somebody to commit to a plan of care should be harder than getting them to finish a plan of care. So let's say 80% of those people actually finish it. Now we've got basically 6.5 people that are going to finish a plan of care, right? Now let's say we just have 50% of these people decide that they want to move over to a continuity offer. Same conversion percentage as Clinic 1. Well, that's going to leave you with a little over 3 people versus 1 person in Clinic 1. Now, if we take those numbers and we say, what does this look like if this happens every single month for a year? Not even looking at the front end revenue from the actual plan of care. Let's just look at the actual continuity revenue that's coming in. By the end of the year, Clinic 1 is going to have 12 people. If that one person each month sticks forever, they're going to have 12 people at the end of the year that are coming in for some variation of a continuity offer. And let's just say that that's $200 a month, right? It's just to put a number on it. Well, they're going to generate $2,400 in revenue off of that one person, in continuity revenue. Off that one person each month, it's going to snowball to 12 people. Clinic 2 has 3 people. 3 people that come in each month for continuity offer, and that snowballs. By the end, they have 36 people. That's $7,200 in continuity revenue if it's $200 per person times 36 people by the end of the year. Would you rather have $1,200 or $7,200 at the end of a year for literally the same number of new patients that are coming in? This is what we're talking about in regards to tracking the right things, because most clinics, the number one thing that they focus on is plan of care conversion, which is fine, because that's actually where a lot of people suck. And if you can just get better at plan of care conversion, that can have a very meaningful difference for your clinic alone, right? Just by that alone, if you go from converting 25 people to a plan of care to 60% of people to a plan of care, your revenue is going to improve dramatically. But you're missing all the rest of this. And there's this phrase, amateurs focus on the front end. So amateurs focus on just that initial plan of care. That's it. And they forget about all the rest of it. And if you want to become a better business owner, if you want to become a more advanced business owner, you have to look at these other drop-off points, because they're just as important, if not more important, especially when we start to look at continuity. So completion of a plan of care, you got to get people back in. Schedule people out for visits. Get them set up for 4 to 6 visits day one. Build it out. Say, hey, my schedule books up really quickly. Let's go ahead and get you scheduled for the first 6 visits of this, first 6 weeks in a row, or whatever you want to do. Let's get it on the books. If we need to reschedule something, we can do that, but I'd rather save a spot for you while we can do so. Awesome. Book out the visits as much as you can. Get them in to finish a plan of care, finish to completion. Because if you can't finish to completion, you have no chance of a secondary sale. You have no chance to actually move them into something that's going to help with whatever their goals are long term. That's just as important, if not more important, than where they're at right now trying to solve an injury, right? So you got to focus on getting them in. You have to communicate with them the importance of doing the work, right? You can't just do half the work and expect that it's gonna all turn out as well as it would if you did all of it, right? You have to finish the drill. The third part, and this is where a lot of people don't track it at all, is how many of these people are sticking around. This could be buying another package of visits they just want to chip away at because they like coming in to do manual therapy work, right? This could be doing some sort of structured membership with you in person ongoing. This could be remote programming. This could be small group work. It could be any number of things that you have that are going to help them achieve their long-term goals of being healthy, of being active, and being able to live a high-performance, pain-free life. That's what so many people want these days. They don't know where to find it. And now they're in your office, and you have a chance to legitimately change their life by getting them into a small group where they can train and they can get stronger and they can move better and they can be around other like-minded people. And if you don't finish their plan of care, you got no shot at actually getting them into this continuity offer. So you got to finish the plan of care, and then you have to give them an opportunity to do something ongoing that's going to help them achieve their goals. And when we see people do this, it not only allows them to work with people in a much more meaningful way, but it will change your business. So remember, these are the 3 big drop-off points that you can focus on. So number 1, conversion. This is what a lot of people focus on. Make sure you're having conversations about why they're in the office, not necessarily because their knee hurts, but like, why is it important, for you to be healthy and active? Oh, because you coach your kids' sports teams, and for you to run around on a basketball court, with your middle school kids, is causing you a lot of pain, and you can't do that. Awesome. Now we know why you're there. Now we have something we can hold you accountable to. Now we have something we can talk about that is a driver of you doing this uncomfortable stuff we're going to have you do between manual therapy that probably didn't feel so good and weird little exercises that are uncomfortable and tedious. Now we can tie it to that, right? Then we get you in the office. We got to make sure that you're finishing it. And then we're going to make sure we have something that we offer you. Maybe it's appropriate for you. Maybe it's not. Maybe you're the kind of person that wants to go back to the gym that they came from. Awesome. That's why we leave our continuity percentage at 50%, because for a lot of people, it may not make sense, but for a significant amount, it does. And if you don't have something to offer them, then you got no continuity. You have no recurring revenue. And that is a terrible place to be as a business owner. So conversion on the front end, completion of the program in the middle, and then continuity on the back end of the plan of care to give them an option to work with you in an ongoing way, as long as you provide value, right? That is the key. So focus on these 3 areas. Remember the scenarios that I talked about with these 2 clinics. Which one do you want to be? Clinic 1, that's ending with 12 continuity sessions at the end of the year, or clinic 2, it's ending with 36, 3 times the amount, just by focusing on improving these 3 areas. So hope that you like this one. Hope that was tactical enough for you. These are 3 very important areas to focus on. Go check them out in your business. See if you're even tracking these. You can at least look at your benchmarks for what you want to see. Our benchmarks, we typically want to see people be somewhere around 70 to 80% plan of care completion, especially if it's an individual clinician. Like if you're just the only clinician and you're the owner, you should be completing plans of care or converting people to plans of care 80+%, right? You should be really good at this. If you have staff, 70% is good. Like that is definitely very, very, very good. Completion of plan of care, we want to see 80%. 80% of people that are coming in should finish a plan of care. Like there's no reason why they're paying you for this. Like they're paying up front for a plan of care in order for you to help them achieve a problem or resolve a problem. All you got to do is get them back in the office. Like 80% it should be the benchmark, and then 50% should move over to continuity. That's where you can benchmark yourself. If you're not there and you want help on these things, head to physicaltherapybiz.com. Take a look at what we're doing. We help people improve their cash and hybrid-based clinics all across the country. It's not rocket science. You just aren't a great business owner just yet. But you can be if you want to learn that, and we can help you with that. So head to physicaltherapybiz.com. I think we can help you if this makes sense to you. As always, thanks so much for watching. Catch you on the next one.